Hello everyone. Today is the second video in the PLAB 2 Secrets series. So today we'll just take a look on the structure approach of your station. So for each station or for all stations, you should have, in your mind a certain framework which you should follow. So we can divide our station or our consultation into phases just to be able to memorize it. So for example, here we will have it in 7 phases. So each consultation you will do or each station you will perform, you should follow and you should cover all of these phases. So we have 7 phases. It will start with phase number 1, which is meet and greet and introduce yourself. So you should not start your consultation or your station without greeting your patient and introducing yourself. And it's a very big mistake that you will start directly asking about patient complaint or the reason of visit. You should introduce yourself and greet the patient and welcome the patient before starting. Either the patient coming for the first time or he's coming as a follow-up or you saw him before, you should greet the patient before you start your questions. Phase number 2, which is the longest phase in your consultation, and it's history phase. This phase will cover all history taking parts. So it starts with history taking of the presenting complaint, and there's special technique for this step. We will know it in the next video. We will cover the phase number 1 and phase number 2 in details. So we will start our history taking by asking the patient about his presenting complaint, and it should be done through the 2 open-ended questions, and we'll explain all of that in the next video. The second thing to be covered in the phase number 2 is elaboration and analysis of the presenting complaint. For example, if the patient is presented with abdominal pain, so you have to analyze this pain through asking question related to the pain, like what are the site of the pain, onset of the pain, character of the pain. All of this is called analysis of the presenting complaint and elaboration of the presenting complaint. Then you should ask about the red flags. And red flags, of course, it will differ from condition to condition. And red flags, it should exclude serious condition. So from its name, red flags for the serious condition. Serious condition include either emergency condition or cancers. And the 4th thing should be covered in the phase number 2 is the past medical history, then the personal history, and then social history, and the last one is the differential diagnosis of the presenting complaint. So this is the phase number 2, and as I told you, this is the longest phase in your station or in your consultation. So phase number 3, for the phase number 3, actually, this phase is not only coming after phase number 2. This phase should be throughout your consultation. So throughout your consultation, you should show sympathy and empathy. You should respond to the patient emotions. You should identify any nonverbal clue from the patient side. So this phase should be covered throughout your consultation. After that, there's phase number 4, which is the phase where you will explore the ICE. So ICE stands for ideas, concerns, and expectations. There will be separate video for how to explore ICE, because there's some certain techniques which you should follow to explore ICE. If you just ask a patient what's your idea about your problem, what's your concern, what's your expectation, it should not be like that, because it's not accepted in this way. You should know how to ask about ideas and concern and expectations. After that, there's phase number 5. Phase number 5 is summarizing phase or summarization phase, and it should come after the history taking. And there's also some certain technique on how to summarize the history part of your consultation. And this phase is very important, because if you missed anything, if you didn't pick up anything in the history taking, you can get it in this phase. Phase number 6, which is a physical examination, In PLAB 2 exam, many stations didn't include the physical examination, or physical examination is not required in many stations. So when you reach to this phase and you will ask the patient for the examination, though, so the examiner will tell you that assume that examination is normal or unremarkable. So this means that examination is not required in this station. However, in many other stations, examination is important and you should do it in details, and you should do it completely. So now we reach to the phase number 6, and finally phase number 7, which is the last phase of the consultation. And sometimes they call it the end of consultation, or sometimes it's called the counseling. So in the phase number 7, or ending of the consultation or closing of your consultation, there is about 7 or 8 points you should cover. Not all of them are essential. However, some of them we can consider them as a plus or minus. It depends on the situation, and some of them are essential. So first one is reassurance and explanation, which some people call it disclosure of diagnosis, which means that when you reach to this phase, you should know what is your case. So this is a case of cancer bowel, or bowel cancer. This is a case of gastroenteritis. This is a case of hypothyroidism. So now you will have idea from what you have earlier in the consultation, what is your case. So here you have to explain to the patient his own condition in a simple way and without using any medical terms. If his diagnosis is something benign, or if his diagnosis is not something serious, so you have to reassure him also. Then you have to talk about the non-pharmacological advice or non-pharmacological management. Sometimes also it's named as a lifestyle modification. And the next step is the pharmacological treatment or pharmacological prescription or medications. And you should know what are the management of your condition medically and non-medically, pharmacologically or non-pharmacologically. The next point is the referral, if it is indicated, if your patient need to be referred to other specialty. And also we will talk about this phase in a separate video. So each referral, there is specific requirement for each referral. You have to tell the patient, for example, why you are referring him, to whom you are referring him, and what's expected from this referral, and when it will happen. So all of that, it should be covered if you will mention referral in your counseling or in your management. The next point is investigations. If you will need to do any investigation for the patient. Sometimes investigation could come a little bit earlier, in just after the examination, but it will be in just certain stations in the PLAB 2. And next step is safety netting and follow-up. So before closing of your consultation, you should make sure that you cover all safety nettings, and we will talk about this safety netting in a separate video, the video of the phase 7, and what you have to do to cover the safety netting. And the last one is prevention, or sometimes they call it as opportunistic health promotion. For example, if you have patient and during your history taking, you pick up that the patient is a smoker or he's drinking alcohol heavily, so you should address this issue at the end of your consultation by offering the patient help if he is willing to have for smoke cessation or controlling of excessive alcohol intake. So it's called prevention or opportunistic health promotion. So that was our video today, just to have insight and idea about the phases of your station or your consultation. And then from the next video, we'll start to have all of these phases in details and what are the techniques you should follow to cover each phase properly. And after finishing these videos, we will just talk about how to apply all of that practically on one of the cases. Thank you for watching this video. If you like the video, don't forget to press like and share the video with your friends. Don't forget to subscribe to have access and to be notified for all new videos in this series. Thank you for your following.